Hey everyone, thanks for joining me for my interview series. And today I have a really awesome speaker for you, Jessica Oldham, who is a psychiatric nurse practitioner and is the owner and provider at Rocky Mountain Mental Health. She's going to talk to us today about how you know when you need medication, how to find a good prescriber, finding the right balance of medications and supplements with lifestyle demands, and a special little shout out to perinatal mental health for new moms out there. I know you're going to love it. Don't forget to subscribe to my channel so you can make sure to get all these great interviews and access to all the goodies that are on here. And I will let you enjoy the interview now. Here's Jessica Oldham. All right, Jessica. Hi, I'm so happy to have you here with me today.
Hi, Kate. Thanks for asking me to do this.
You're welcome. I'm so pleased that you said yes, and I'm really excited to share some of your expertise because I know that the prescription medication piece can be kind of like a tricky balance for people sometimes when dealing with mental health. So maybe before we dive into that, can you just tell us a little bit about who you are and kind of a couple minutes of introduction about the work you do?
Yeah, great. Yes. So my name is Jessica Oldham. I'm a psychiatric nurse practitioner. I own and operate Rocky Mountain Mental Health. It's located physically in Littleton, Colorado, although right now we're doing everything via telemedicine. So it's myself, Sarah Mobley, and Jennifer Livingston. They're other psych nurse practitioners that are our practice providing services. And we assess and diagnose and come up with treatment plans for a variety of mental health issues. But I will say that our specialty is perinatal mental health. And so that means we provide services to people that are planning on becoming pregnant or postpartum. A lot of people who are becoming or planning on becoming pregnant or on medications that are wanting to know like what are the pros and the cons of taking medication during pregnancy. But it would be like if maybe they didn't take medications during pregnancy. And so that's a specific service we provide, but also just general psychiatry. So we see kids down to the ages of 5 and up, and a variety, of mental health issues such as depression, anxiety, ADHD, bipolar disorder, etc. I started the private practice in 2016. And that was kind of around a time where I myself had my own perinatal mental health struggles. And I noticed that there was a lack of resources when I was trying to look for resources myself. And so that kind of led me kind of down this path of, how could I provide a specialized resource to patients that are, experiencing that within that community. And then that's kind of grown since then.
I love that you're coming from a place that you already sort of know within yourself. I feel like as a treatment provider, that gives such a deeper level of empathy and compassion for your patients. So I really admire that you're able to sort of bring that forward
Yeah.
in your work.
Yeah, thank you.
So there's like this tipping point I've found with a lot of my clients in therapy where sometimes people are just really unsure about if they need medication or how do I know if I need medication? People are telling me I need medication. So I'm
Mhm.
just curious, can you kind of speak to that tipping point from your lens? Like how would you be able to advise somebody to become assessed or to sort of seek psychiatric medication?
Yeah, I think that's a great question. And I honestly get that often when people are calling the office to discuss setting up an appointment. Do I need to? How do I know that I need to? And it's really hard because it does tend to be kind of individual. But I think some key factors would be like severity of your mental health issue. So if it's really impacting you significantly, where it's making your day to day function, where you're not able to do it, or it's really impaired, then you may consider having a psychiatric evaluation to see if medication would be a good option. Or, as you brought up, Kate, like if you are working with a therapist and you're feeling stuck and you're not getting much movement, or you feel like you're not able to utilize the skills that you're learning in therapy because maybe like you're a motivated and there's not much drive for you to be able to do it, then sometimes medication is a good option to kind of get you out of that rut so that you can then kind of work on the skills that you're learning in therapy. Um, and like I said too, there's particular like different disorders that sometimes are better managed too by medication treatment. And so if you think that that's possible that you have a disorder that you really need medication, then I recommend doing a consultation with a provider. One of the great things I think that has kind of happened is that a lot of providers provide a free 15-minute consultation. And so then you can call, we provide that at our office, and then you can call and you can get speak to a provider briefly. They're not going to, tell you what medications or anything you need to be on, but they could maybe say, it sounds like you would be a good candidate for having an evaluation. Or we point our patients to you and what they're looking for. Like we often get patients who call and they're interested in therapy, and we don't provide those services at our office. It's mainly medication management for psychiatric issues. And so we'll point them, in a direction of, here's some therapists to consider based on like to what you have going on. So it's really kind of an individual kind of, and like a individual severity of symptoms. And two, if you are working with another provider that is a mental health provider, like I said, a therapist or acupuncturist, and they like recommend maybe looking into something like that, then that may also be kind of a tipping point of, okay, maybe I need to find something else if this provider is feeling like they've kind of maxed out their resources of being able to help you.
Yeah, I'm really familiar with the way that looks from the therapist perspective with someone who like we can never get to the deeper work because we're always doing sort of the damage control of like
Yeah.
I can't get out of bed, I'm so depressed, or like I
Right.
can't function, I'm so anxious, or my moods are all over the place. And so it's like the entire therapy session is about resourcing and calming or coping, and we don't get
Mhm.
to like why, where did this come from? So
Right.
usually when I will send people for a medication evaluation, it's like just to help them to reach a stable baseline where we can then do the really meaningful work. And I'm curious to ask you too, sometimes people just need that baseline for a temporary time period, right? And then once we can reach that deeper work, their system gets sort of re-regulated in a new way and they find they don't need the medication anymore. So can you speak to like when would we know that a medication is sort of just a short term resource, and at what point are medications longer term for people?
Oh, that's a great question, and it's a little complex because it kind of depends again, kind of on that person's particular situation. For example, if this is your first episode of depression, it is likely that you may only need to be like, once your symptoms have remitted, they're gone, you're stable. It may only be like 9 to 12 months that you need to be on the medication, and then you can look at tapering off. Have some patients who have had repetitive episodes throughout life of depression. And so we know that that means they're more likely to have another episode. And so because of that, then they may choose to continue to stay on medication for a longer amount of time. So that's kind of an example. And then there are some disorders that may have psychosis related or bipolar disorder that may be more of a chronic disorder that may require more longer term medication. So it is kind of tricky sometimes to figure out until we kind of get to know the patient and really understand like, okay, is this something they're going to need to be on long term or not? But there are many times, for example, like depression and anxiety, where we get the patient stable with medication and they're also doing therapy. And then, like you said, they're able to taper off and utilize those skills, and then they may never have another episode of that happen again. So it really is kind of person dependent and situation dependent.
Yeah, I imagine that you see some of that with the perinatal work just because there's so much hormone fluctuating, their entire life is changing, relationships are sort of stretching to bring the baby into the family. And so, of course, you're feeling some instability and emotional dysregulation. And so, I think that would be maybe an example of something that comes and goes. And maybe specific to perinatal depression, can you talk to the topic of baby blues and how baby blues might be different than depression or a more severe psychosis brought on by that kind of point in life?
Yeah, no, that's a great question. So with baby blues are they're not going to last typically over 2 weeks. And they're going to be mild in the aspect that, yes, you may be tearful, you may feel down, but it's not impairing your ability really to be able to care for your child or do, your basic hygiene and stuff. Although I know basic hygiene sometimes can be hard whenever you have a newborn, but
Yeah.
the ability to actually do it can go away for some women who actually are developing postpartum depression. So if it lasts over 2 weeks of feeling down and blue and sad, then also it's impairing your life, meaning that it's causing your difficulty in your relationship with your spouse, your baby, you can't work, then those are big signs that maybe you have more of postpartum depression. Now, you did bring up the point of the postpartum psychosis.
Mhm.
It's very, very rare, but it is, whenever it happens, it's very concerning and we need to treat it as soon as possible. And so, what that can look like is having delusions, which are like fixed false beliefs that oftentimes it can be related to baby, and then usually it's not because the person believes in these delusions. um, it's hard sometimes for them to really see that they have something odd going on or something is off.
Mhm.
And so it's really the family that will start noticing because maybe the mother is saying things that just really aren't adding up, or times maybe they're seeing something that's not there or hearing something that's not there, and it's really picked up by the family, which can be very, very terrifying for families to notice that and see that that's going on. And so we always encourage families, if you feel like there's something off, make sure that you get in touch with a provider, whether it's an OB or if there's already psychiatry on the team, making sure that psychiatry is notified so that you can get the mom help as soon as possible.
Mhm. And I imagine that that shows up even outside of perinatal mental health with men and women, people who are in huge transitions in their life. Maybe they've lost their job, maybe they're having a divorce or going through deep grief.
Mhm.
So, what other kind of transitions have you seen in your work other than perinatal mental health where people have these sort of big influx of a psychiatric need that then eventually can taper down?
Oh, yeah. So we do see a lot of like college age students. So um, people who are transitioning from maybe living at home with their parents and going out and being independent on their own. We do see that a decent amount. We also see a lot of like perimenopause or menopause related issues that kind of fall in that women's mental health care. We see a lot of people who are having job changes that kind of, add to, they may have just a little bit of anxiety that they tolerate or they deal with in, variety of different ways, whether it be therapy, acupuncture, massage. But then whenever they have one of these triggering events, like losing a job or getting laid off or losing a family member, that can kind of bring up some of these symptoms that were there, but just kind of exacerbates it.
That makes sense that if there was like an underlying current that was just easy to manage when something ruptures in their life, it's just right there at the surface. I
Right.
think of like our pandemic experience when I think of that. It seems to me working with people through the pandemic that that's exactly what happened. There wasn't really a universal response to the pandemic, but it was whatever your thing was that was close to the surface kind of came bubbling up, and for a lot of people it was unmanageable, and that was a time when they needed some psychiatric medications.
Yeah, I 100% agree. And I don't know about in your practice, but currently in our practice, we are seeing some challenges too with people getting back out. So
Mm.
people have spent a lot of time at home. And for some people, socializing or getting back out into the world is really scary for them. And so it's been hard for them to reintegrate back into society and being more social. And so we're seeing a little bit more pickup in those particular, issues. And so it's interesting how the pandemic, it really brought on a variety or exacerbated a variety of different things for a variety of people.
It was just this massive trigger, I think. And in
Mhm.
some ways, I think it promoted a lot of awareness and growth that people really needed to do. And in other ways, it was really dysregulating. So I'm so thankful that people have had resources like yours to come to for help. I have a question about the kind of balancing the scales in some way between psychiatric medication and supplementation with like herbs and nutrition and over the counter kind of supplements. What is your take on that? And how would you work with somebody who was, the kind of person who says, I don't like medicine, but
Yeah.
I think I need something? How does that go for you?
I would say that's like half of the people that we see as new patients
Mhm.
feel that way. I think that medication to an extent actually has the stigma associated with it that's really negative, and which some of it I can understand where it came from over time. But I think that, there's a place for both, for supplementation, whether it's herbal or vitamins, and also then with prescription medication. With prescription medications, some of my personal thoughts is that if you have a severe issue that is really causing significant impairment, prescription medications may be at times a better option versus, supplementation. For example, like if somebody's experiencing psychosis, it's a pretty significant and impairing issue. And so medication is shown to be pretty effective at being able to manage that, whereas supplements that may be, not as effective. And so it's really and two, with prescription medication, I'll say that there's quite a bit of data and research out there. And I think that unfortunately, there is less data, not always, but for most supplement related stuff because of, how it's driven by, the pharmaceutical companies. They put a lot of money into their research and there's not as much money oftentimes for the supplements.
Right.
But there are plenty of people that I see that do a combo of both, or people who have tried supplements and found that they didn't have any improvement. And so they're then wanting to move on and maybe try medication. And then too, like I said, I have people who I work with. I love to collaborate with other individuals like naturopaths and other holistic providers. And I also think that's very important actually to note is that if you do want to take a supplement, I really highly recommend finding somebody who specializes to help guide you through that process. Because I have a lot of people who have a misunderstanding that, because I'm taking this herbal supplement, it's natural, therefore it doesn't have side effects. And so it's important to remember that those do have side effects actually too. And so helping somebody, getting coordinated with somebody, a provider who specializes in that can help kind of help you through that. And like I said, we'll coordinate care. Like at our office, if somebody is taking a combo, like they want to take some of the supplements, but they also want to take prescription medications,
Mhm.
it can be kind of tricky because some of those meds have interactions that don't work well or play well with each other. And so we can't give them at the same time. So it's important if you do that to have people like a team of people that are able to help you with it.
Yeah, that's a really valuable reminder. And especially because not all supplements are created equally. And
Oh,
so, there could be something as simple as fish oil that, there's the really clean kind of straight up fish oil, but then most of what's on the market has all kinds of synthetic fillers and chemicals and natural flavors and just all of these things that can really create more side effects. They can interact poorly, so I feel like having somebody to help to say, this is a supplement I trust, or this is a company I trust, and, working as a team around that, I think it's important not to just think, oh, I bought this at Whole Foods or Natural Grocers, and so it must be okay.
yes, no, I think that's a very valid point. And that, pharmaceuticals, they're pretty heavily regulated, although, sometimes we do have stuff come out. Like had an issue not too terribly long ago with Wellbutrin, and it's generic, just not being as close as what it was to the name brand. And some people would notice a difference between the name brand and the generic. And yeah, you make a very valid point that some of the regulations with the supplements, they'll say that it's, vitamin C or whatever, but then when like a lab tests it, then they find that that's not true. And there's all this added to this stuff. And so, yes, it's very important to have somebody that you know and trust that recommends a brand of supplements that you feel comfortable with because you feel like you know what you're getting.
Yes. Can you speak to the part that alcohol and marijuana and other substances play when you're taking psychiatric medications? Because I know that there's always the warning that says don't take this while drinking alcohol. And a lot of people disregard that, or some medicines don't say that. So, can you speak to that a bit?
Yeah, no. So many of our medications will have that warning of, not mixing. And there's a variety of different reasons as to why. There's certain medications that will have an interaction where maybe it'll make you like more sensitive to alcohol. So you'll feel the effects of it more. And therefore, you may become more intoxicated faster and you don't realize that. And that can be obviously problematic. Same thing with marijuana. There may be, marijuana may have a negative interaction with the way that it's metabolized with other medications that maybe speeds it up or slows it down, the metabolism of the medication, which then can cause higher levels of the medication in the body than what should be. And so it can really just in general affect either its effectiveness or its and causes more medication or the medication to be a higher dose or lower dose. And so when you have all those variables thrown in there, and then it becomes kind of hard to figure out like, okay, what do we need to do if you're not feeling well? Because we have too many variables going on here and affecting one another. So if we can reduce those as much as possible and reduce the likelihood that you'll have harm from combining all those together, that's more ideal. But I agree with you. A lot of people, disregard the possibility of interactions of mixing medications with drugs.
Right. And they forget that substances and substances don't always work together. And just because we have alcohol is legal, marijuana is now legal in Colorado, people just think, oh, it's legal, so I can just take it and, it's going to be fine. And I think that I've talked to some prescribers who ask people if they are either using marijuana regularly, drinking alcohol regularly, or any other substances regularly, that they try to stop while they're taking their psychiatric medication so that you can know what their baseline is. Because if someone is on marijuana every day, how they present isn't really their baseline if they're never at that sober place. So they may be presenting with much less anxiety,
Mhm.
and it would be valuable for you to know their raw state. So, how do you deal with that if someone has an underlying addiction that maybe they aren't even aware of, or just a habit they've created that feels like it's difficult to let go of?
It kind of depends on what substance it is, because in our practice, we don't specialize in treating substance use disorders. So if it's very significant, like if there is an opioid use disorder, we don't really prescribe the medications usually that are needed to help individuals with that. And so we'll recommend them to other practices that are in the area that specialize in that. But we do try to encourage people. For example, if somebody's drinking alcohol more in a week than what is recommended, then we'll come up with a plan. I like to meet my patients where they're at.
Mhm.
So, it's not realistic. I can tell them all day, I want you to decrease your alcohol intake and only have one drink per week or whatever it is I think, would make sense, but they may not agree to that and they may not think that that is doable. And so I try to meet them where they're at and say, okay, what is doable? What do you think you can do? And how could we kind of decrease this over time and have them be an active participant and coming up with the plan that they feel like they can do. There are times where we will, as long as we feel like it's safe enough, we will go ahead and start a medication because it could be that they're so depressed that therefore they're using marijuana to help their mood. They feel like it helps, and therefore it's hard to stop the marijuana because they're so depressed. So then sometimes if we do treat a little bit of their depression, then it makes it more easy for them to stop marijuana use. But again, with all the interactions, it becomes kind of tricky of figuring out ethically, like, what is a good solution here? I want them to get better, but I also don't want them to have an interaction. And so, again, it's kind of like cultivating these individual plans for each person based on kind of their needs and based on what they're willing to do.
Right. That reminds me a bit as you're talking about how, the thing that you're doing might be helping you. So maybe don't take it away right away, but the medication will eventually change your system enough to help. It reminds me of the statistics we have that sometimes when people start an antidepressant, their suicidal thinking actually increases. And
Mhm.
so, can you speak to that a little bit so that people? I've had a lot of clients who are really afraid to start a medication because they don't want that suicidality to increase. How do you monitor that and support people through that?
Yeah, so we always do a suicide assessment during every meeting that we have looking for that. So we will, perform that assessment. If we see that their risk factors come up, we will let them know. We'll come up with a plan of how can we reduce the risk. I mean, the data has been kind of back and forth, and I've listened to a lot of different schools and thoughts about the possible, suicidal thoughts, and it's mainly among the age group of like under 24 years old is what the black box warning is for. And so they don't think it's as much happening in like adults. I have like anecdotally, I can't say that I see it very often. There maybe been a few times out of hundreds of patients that I've seen that it feels like it has came up and it's really coincided. And it's kind of hard to tease apart too, because some people have had fluctuation in their suicidal thinking throughout, the time that they've been sick. And so it's hard to pinpoint like, does that really seem like that is probably due to the medication or not?
Mhm.
But I also tell people you have to weigh out kind of how you're feeling. And also, I tell people if you have that come up, contact me immediately and also get help immediately, emergency help. But we can kind of figure out together if it feels like it's related or, come up with a plan. But I do think the statistics are kind of pretty low, the likelihood that it's actually going to happen that you have that come up. And that's why we devise this plan, include, depending on, how old the person is including other support people too. Like, hey, this may come up. And if it does, then we want everybody to be prepared and ready if it does come up. Um, but I don't really, quite honestly, see it too often.
That's good to hear. And I like the approach that you have about meeting people kind of where they're at when it comes to that as well, and really making sure that no matter who they are, they have those resources if and when they should need them.
Mhm.
And it reminds me just of how important it is to find a good fit when you're working with somebody, especially for those people who might be afraid or a little nervous of starting these medications,
Mhm.
to build a relationship with a prescriber that is going to take it slow and is going to be there to support them and has an emergency line that they can call if there's a thing that pops up in the middle of the night or something scary to them. So there are so many different kind of prescribers out there. You're a psychiatric nurse practitioner. There are psychiatrists. A lot of people get their medications from their primary care providers. How would a person know who to go to and where to begin if they feel like they're ready to explore medication?
Yeah, so I think again, it comes back to like individual severity of symptoms. So, for example, if a patient's working with a therapist, oftentimes a therapist can kind of guide them of, okay, maybe you're having some more struggles that could be potentially helpful to be treated with medication. And so, I think referrals really is where it can become helpful for the patient of family referrals, friends, other providers that they see, so that maybe then that will be a segue into calling and kind of gaining more information. Versus sometimes it is harder just calling down a list. I mean, I've had so many patients that are like, I've spent 3 hours calling down a list today of people trying to find a provider. Um, and so that's where I think, if you can find some referrals from, trusted medical providers or mental health providers that then that could be, really helpful. But I mean, like you said, there are a variety of providers, psychiatric nurse practitioners and psychiatrists. I know there's some also physician's assistants who specialize in psychiatry. But the good thing is there are a lot of different providers that can provide very similar services. And I think the bigger piece that I hear from my patients is finding someone you connect with and you have a good relationship with
Mhm,
that you trust.
mhm.
And then if you do have a psychiatric appointment with someone that you feel like, nah, that's not a really good fit, you may want to find someone else and find somebody you feel like is a better fit if you're not feeling heard or understood.
Mhm. Is there a different style of practice from psychiatric nurse practitioner to psychiatrist to primary care doctor? Are there different sort of schools of thought for how to treat things?
Yeah, so I mean, primary care providers, they are trained in, basic psychiatry, so they can manage things oftentimes like depression and anxiety. I'll say that, if you try one or two treatments with your PCP and you feel like you're not really gaining much as far as symptom relief, or you find that you're having a lot of side effects that are hard to manage, then you may consider at that point trying to go to somebody who specializes so that you're not continuing to kind of waste some of your time of trying to feel better. Because like I said, the primary care provider, they're trained in basic psychiatry, but they don't have a deep dive in of psychiatry. And so they usually will refer out honestly after, one or two trials of a medication. And then as far as, psych nurse practitioners and psychiatrists, we practice and function very similar, I believe. I think that it's more the difference is going to be on the individual basis.
Mhm.
There are certain psychiatrists that I have a very similar style to, and there are certain ones that I don't. And the same thing with other psych nurse practitioners. Some may have more of a holistic philosophy, and some may have more of a medical based philosophy. And so it really can kind of vary more based on like the individual.
Okay, so there isn't really a one size fits all for
No,
psychiatric nurse practitioners are holistic and psychiatrists are clinical. Like that doesn't apply.
no,
Okay.
no, I don't think so. I will say like based on I really enjoy like nursing theory is such a thing. And a lot of it, the model of nursing is much based on caring.
Mhm.
So it's like you may not be able to quote unquote cure everything, but you can always be like a caring provider. Um, and so I really like that about nursing. I think that that though happens with psychiatry too, obviously, but I just think that the actual theory of where nursing came from is based on a caring model. And I really feel like that comes out a lot in our care.
I love that about psychiatric nurse practitioners. When I refer my clients, I usually say that the psych nurse practitioners are just so human and that they have just a softer and more gentle approach.
Mhm.
Because sometimes people will have an experience with
Yeah.
usually a psychiatrist, but sometimes different providers where they're just like, 5 minutes, here's a script, take it and leave.
Right.
And
Right.
I haven't experienced psychiatric nurse practitioners to be that way as much. I mean,
Mhm.
granted, there's always,
Yeah.
exceptions to every rule, but in general, I think that thoughtfulness is really there.
Yeah, and that's where in our practice we really try to focus on that is having a good like patient connection and
Mhm.
making sure that our patients feel heard. That's like our overall goal. And medication is very important, but also to really understand where medication comes in or how helpful it's going to be, we really need to know the patient's story.
Mhm.
And that's where I find that, primary care providers literally just don't have time to hear the story because the way that their time is kind of lined out for the rest of the day. So they may get more of the like abbreviated version of your story. But sometimes I find that we do 60 to 90-minute sessions for the first initial appointment. And when I first started as a psych nurse practitioner, I only had 60 minutes because that is actually what insurance would allow. And I just found like, but I have more questions. Like there are more things that I want to know. And that's why we allow for the 90 minutes.
Mhm.
Because sometimes you get into, somebody's story and you need to know more to really kind of understand it.
I love hearing that so much, just the care and the thoughtfulness that you put into the whole person and really just painting the whole picture of why they're hurting and why they're struggling before you write a prescription that is going to change their chemistry. I appreciate that
Mhm.
so deeply.
Yeah.
So I'll just ask you one more question and then I think we'll close for today. This has been a really great interview. So, is there just anything in your practice that's exciting right now that you want to share, or anything in mental health kind of at large that you just want to kind of give a kudos to before we end?
Yeah. So At our office, specializing in perinatal mental health, we've been growing kind of in that area because there's not a lot of services, like I said before, related to that area, specifically in prescribing. And so we have, made a lot of connections within the community and OB providers. And we also the pandemic has kind of put a little bit more of a squash on this, but we were doing kind of some times where we would go provide educational information to OBs in regards to perinatal mental health, because a lot of times they see perinatal mental health issues come up, and it's so hard for them to keep up to date on everything that's going on in the world of perinatal mental health because they have all this medical stuff to keep up on. And so we provide a lot of like educational support to them, to hope that they can be able to provide better services to their patient. So we also, like I said before, we have myself, and then we have a couple other providers, and they also specialize in perinatal mental health. Sarah has a lot of experience with like infertility related treatments in mental health and that crossover. And then Jennifer actually worked as a labor and delivery nurse in the high risk area for 10 years and managed a unit on that. And so she has a lot of really great OB related experience. And so we're really excited to kind of continue helping, the perinatal mental health community, and, continue to kind of build the business as it goes along. The need has just been really increased over the pandemic. And, I kind of think about the stories of the moms that I see of how much they are just at home secluded for so long because of the pandemic, and how tough it has been on families during this time. And so we're just been really happy that we've been there to help and provide the services that we do.
Me too. It's such a valuable service that you do provide, and you do it with so much grace and compassion. And I just really appreciate hearing you speak today and being here with me. So, thank you so very much. And I appreciate this. I think our viewers are really going to get a lot out of this video.
Thank you. I appreciate your series. I'm excited to see the rest of them.
All right. All right. Well, thank you, Jessica. And maybe we'll have a follow up or something someday if people need it. Feel free to comment below if you do want to have a follow up. But for now, we'll just say goodbye.
Awesome. Thanks, Kate.
All right. Take care.